Lots going on today in the different provinces, and of course, questions for the Trudeau government as well about the deployment of vaccines and this new announcement on a therapeutic drug. Let's bring in CTV's Evan Solomon, the host of Power Play in Question Period. Hey, Evan, good to see you.
Hey, Todd.
Okay, let's ask the first question here about therapeutic drug and the efforts to procure this drug from Eli Lilly.
Yeah, there is a war to get all these things, and Justin Trudeau and like all leaders are trying to get either a vaccine or this Eli Lilly therapeutic drug to treat people of this. As you know, cases are spiking all over. But Todd, this is playing into a larger question that the Prime Minister raised today, and he raised it about vaccines, and it will have to do with therapeutics as well, which is Canada does not have a domestic supply. And the Prime Minister was very clear today, and he mentioned it a number of times. Since we no longer have a domestic supply of pharmaceuticals, Cannot Laboratories closed a long time ago, we have to rely on other countries. And Justin Trudeau said, obviously, those countries are going to serve their populations first. And there was kind of a collective, did he just say that? In other words, we know, as Health Canada and the government has confirmed, how many doses from, whether it's a therapeutic or whether it's Pfizer or whether it's Moderna or whether it's any of the 6 or 7 vaccines that Canada has purchased, Todd. We know that we're going to get some. The question is, when are we going to get them? They said the first quarter of the year, but are we going to get all the doses? And is the Prime Minister softening up the ground for a moment when Canadians are going to look maybe in the United States or in England or in Germany where they have domestic supplies, and those people are going to start getting vaccines in the early part of 2021. And Canadians will be waiting for their dose. So, you know, there's an access and there's a distribution side of this, Todd. We thought we were winning on the access, and to be fair to Justin Trudeau, we were. Canada has bought more doses per capita than I think any other country in the world. The question is, when are we going to get them? And the Prime Minister today clearly was saying access is still a battle. We may not get them till their domestic supplies are done there. And there's going to be tremendous pressure on him to clarify that as to when any of these things, whether it's a vaccine or a therapeutic, is going to actually arrive in Canada to help Canadians. And suddenly that's a big question mark.
Yeah, and I'm also curious to get your read on the government coming under fire in Question Period and elsewhere over the following. You know, why did they not try to, come up with some sort of a makeshift domestic production capacity over the last 8 months? It may not have been perfect, may have been a patchwork, but at least there would have been something. I mean, is that at all realistic? Is that a fair question?
Look, there's a question why we let, a public vaccine developer die off, but it was a long time ago. Cannot Labs, which existed for 60 years, is no longer part of the system. These are multi-billion-dollar pharmaceutical companies that are developing these vaccines. The idea that Canada could kind of start from scratch and develop our own vaccine production, it's just not the way it works. And I've spoken to, as I'm sure you have, a lot of medical researchers on this. And even the vaccines that these companies are developing are based on the work that they've done for many years before. This is not a let's start from scratch and try to invent a vaccine. So Justin Trudeau said, look, in the future, we're going to have to think of that because this pandemic has reawakened us to the vulnerability of global supply chains, whether it's PPE or vaccines. But the idea that the Canadian government, when we're paying for businesses and paying to support people and buying other vaccines, is then going to get into the business run by the federal government of inventing vaccines, which is the core competency of Big Pharma and other places, probably not realistic. It's a long time down the road. It's going to be very, very expensive, and probably more urgent on the triage of needs is how much pressure can Canada put on the contracts we've signed with these companies to make sure that they are obliged to give their customers, whether they're in their domestic situation or not, first crack at the doses they've paid for. And I think there's going to be tremendous pressure, and imagine from the American government or any government to say, we want our people to be vaccinated first. Why not? But Canada signed contracts. We paid for these vaccines. The Canadian government's going to say, the law says you got to serve us. So this is a really interesting and tricky moment. And the debate about a domestic supply is an interesting one, and it's a good one, but that horse has not just left the barn, Todd. It's in another field, in another country. That is so far down the road, it will have no impact on this particular vaccine. That's for the next crisis. This crisis is the fierce urgency of the now to get a vaccine.
Great to get your analysis as always, Evan. Thank you.
Thanks, Todd.